Now, people who received the J&J COVID-19 vaccine as their primary dose are now eligible for a third dose. Government says that recipients can choose between J&J and Pfizer for their additional dose. The additional doses are available from today. Now, meanwhile, South Africans are waiting with bated breath if the national state of disaster will officially be lifted as the country marks the second anniversary of the national lockdown this week. Well, to speak to us a little bit more on this, we're now joined via Zoom by an infectious diseases expert, Doctor Jeremy Nel. Thanks so much indeed for joining us. Welcome to the program.
Sure, thanks for having me.
All right, a couple of things. Let's start with the vaccines, because J&J was supposed to be the single dose one, wasn't it? So the second one then should have been a booster. What is the third dose then?
Yes, you're quite right. So the terminology is becoming more and more confusing. But in essence, I think it's probably fair to say that to a first approximation, J&J probably should always have been a two-dose vaccine.
Right.
So whether we regard this third dose as now effectively the first booster, but really officially it's the second booster, the effect would be more or less the same. So whether you're starting off with Pfizer or you're starting off with J&J, both are now three-dose courses, which is, I think, to be welcomed.
All right, so there was some research that came out last year about mixing and matching the vaccines that you take. Is that something that should be encouraged as well, that if you did the first two with Pfizer, then maybe do J&J and vice versa?
I think the big thing with the mixing and matching, the so-called heterologous boosting, is that it's safe, and that part has been well established now throughout the world. And then the question really is, as you say, is there a recommendation to do it? Now, Department of Health has not necessarily recommended people switch vaccines, and they've actually suggested that if you've got one, you stick with it. I think in practice, many people, if they're on the Pfizer, I don't think it makes any difference what the third dose is, whether it's J&J or Pfizer. If you've had two doses of J&J, though, I think many people may decide that they would prefer Pfizer because it's maybe slightly more what we call immunogenic, so it stimulates the immune system a little bit more. But really, these effects are likely to be quite small. The big thing is the number of doses rather than the vaccines. But I think the big advantage here is that we now know that it's safe, and so it just gives people more options.
All right, we know they both work, but they work in slightly different ways, don't they? Could that be the magic?
I think the big thing is what the vaccines are designed to do is to keep people out of hospitals. So they prevent severe disease. For that, both of these vaccines are excellent, whether you use J&J or Pfizer. There are small differences, but we're really talking about at the margins here. And from a public health perspective, it's not a big difference between these vaccines. Either one of them are very good. And I think really what this is doing is just offering flexibility to people who maybe have a reason to prefer one over the other, or just wherever there's stock available, if there's one, not the other when you turn up at the vaccination station, or a variety of other reasons. This just builds in a lot of flexibility into the program in a way that I think will help people get vaccinated, hopefully.
Again, these protocols have been shifting over time. At the moment, if you get a first jab, how long should you wait for the second, and then how long should you wait for the third?
Yeah, it's a really good question. So it has shifted, and the advice from the Department of Health has shifted based on the evidence which is accumulating. So if it depends which vaccine you start with. If you've started with Pfizer, it's now 3 weeks at a minimum between doses. And if you've started with the J&J vaccine, it's now 60 days. So it's about 2 months between doses. And that's for the first and between the first and second. And then from the second to the third dose of either course, it's recommended to be a minimum of 90 days. So this is different, I know, but the EVDS system hopefully will help. And I very much have sympathy. I can't remember it. I have to write it down. It's difficult to keep track.
And what is the third dose doing?
Yeah, so the third dose really is stimulating the immune system again. And we know that the immune system with many types of bugs and therefore with vaccines too, gets better at attacking this bug and the more times it's exposed. So we know, for example, there's many types of vaccines that children get and have done for years, where it's not just a once-off vaccine. There's 2, 3, or sometimes 4 or 5 doses, depending on what vaccination it is. So this is really aiming to do the same thing. The immune system responds better and better each time. And so giving a booster dose really upregulates the immune system, and you just get a better response in terms of protection that might otherwise fade a little bit with time, or else, especially with new variants, every little bit of sort of incremental benefit that you can get may help with these new variants.
Might this start to sort of suggest like the flu shot, which changes each year? We think we're getting the same one, but actually it's a new one each year because they're incorporating new things. Might that be where we're going with coronaviruses, where we are getting boosters annually maybe?
It's a very good question, and I just think the best answer is we don't yet know. So I think that a lot of it's dependent on what the new variants are. And we understand that, for example, the vaccines that we have now, 3 doses is looking pretty good and pretty durable, and there's no big reason to think that a 4th dose, for example, would be on the cards. But I do think we have to just keep an open mind about this. If we get a new variant, for example, which is very good at avoiding previous immunity, then it may be required to get another booster, but we'll have to play it by ear. At the moment, I'm personally hopeful that these 3 doses will now be enough for a while, but we will have to see how it goes with time. Unfortunately, it's just a bit of an unknown at the moment.
All right, so now the country's waiting with bated breath about what happens with this state of disaster. Some people are arguing that we actually don't have a way to manage this pandemic without a state of disaster. Where are we, do you think, on this COVID-19 curve in terms of what the president can or should not do or should do?
So a very good question. And I think the big thing to understand is that we are in a different phase of the epidemic now, at least. And again, all of this is provisional. We don't know what another variant down the line would look like. But for now, we have good reason to assume that there's enough immunity in the population, both from previous infections and from vaccination, to protect the vast majority of the population from any new variant that may come along, at least any new variant that's roughly in the ballpark of the ones we've seen before. And so that's really what we saw with Omicron, where we didn't get a lot of severe disease despite a huge number of cases. And that, I think, means that we're in a different phase. And I personally would like to see most, in fact, all the restrictions removed. And we can do that in stages. It doesn't have to be overnight. But I do think we have enough immunity now that we're in a different phase. And we need to start to learn to live with this virus. And I would personally like to see most of these restrictions removed, which would also solve, incidentally, the problem of the state of disaster, because the big challenge there is that the Disaster Management Act contains regulations which are very difficult, for example, around mask wearing, to translate into regulations using the Health Act, which is what would happen if the state of disasters ended. So there's a lot of difficulty with moving some of the regulations across, but I think it may be a little bit more difficult than it needs to be, in the sense that if most of these regulations are stopped anyway, it makes the job a lot easier. So personally, that's what I would like to see from my perspective.
What would you keep in the short term? Masks, or everything must go? What do you think, perhaps, if you had to do it in phases, what goes first and what goes last?
Well, I think we can reduce the restrictions, in fact, eliminate the restrictions on indoor and outdoor gatherings, and many of them have fallen away in recent months anyway. I think outdoor masking is a good one to get rid of first, in the sense that we know outdoors is a very, very safe environment compared to indoors for COVID specifically. Things like hand hygiene are very good for many diseases, but COVID is not one of them, in fact. So things like surface cleaning and hand hygiene are things, and temperature screening are things that, in fact, we've known for too long are not particularly effective against COVID and can also go. I think probably the hardest one is the indoor masking, because we know indoors is a higher risk environment. But I think then what we probably have to transition to in the long run is support for people themselves who are at high risk, and say, look, if you are high risk, you should wear a mask, and rather than make it a regulation for absolutely everybody. I do think this can be done in stages, but I would like to see some movement in that direction. Many other countries in the world are headed that way. And I think it's time. I think we're in a different phase of the epidemic, and it would be good to start moving in that direction.
And just to be clear, we're not getting rid of COVID. It's more that we are learning to live with it, and that much like we get flus, we're going to get COVID periodically, but what we've been trying to get to is not getting sick and not going to hospital.
Precisely right. We initially, when COVID started, we had hoped that it would be something that if we rode out via lockdown, we could get rid of. It's definitely not going to be the case anymore. We now know a lot more about this virus, and it's not headed for extinction anytime soon. So we're going to have to learn to live with it. But the way to do that safely is to make sure that you personally are protected, and that primarily, and the best way of doing that is through vaccination. And if you are personally protected, and then if that's true of the population at whole, then we can have a big wave without a lot of severe infections, and that allows us to get back to normal. That's really the goal.
Dr. Jeremy Nel, thanks very, very much indeed. I'm sure there are many South Africans who wish that you could sit next to the president and whisper in his ear what to do. But thanks so much indeed for joining us tonight. All right, that's the head of infectious diseases at Helen Joseph Hospital, an infectious diseases expert, saying that we're at a stage where we really can be getting rid of a lot of these restrictions because probably most of the country has reached some kind of immunity, and now we just need to learn to live with the condition. Hopefully tomorrow we'll